Welcome to the December 2007 edition of Outlook Video, your nationally recognized award-winning show for gay, lesbian, bisexual, and transgender communities. I'm Roberta Gonzalez-Gregg.
And I'm Tom Smith. We are proud to announce that Outlook Video has won a 2007 WAVE Award at the annual Fall Conference of the Alliance for Community Media Western Region, held in the Ventura City Hall late in October 2007. Our
Pride Edition show was a finalist in 2 categories, and we won the award for Community Event Community Producer. Congratulations to us and all our volunteers. Way to go, team. But let's get working on our next award-winning show. This month, we honor World AIDS Day.
I'll start off talking with Dr. Michael Harbour, a clinical associate professor at Stanford University School of Medicine, whose Palo Alto practice supports many in our community living with HIV/AIDS. Stay tuned for Michael's update on current HIV/AIDS prevention and treatments and what is showing promise for the future. To get us started, join me now as I talk with Dr. Michael Harbour about the status of AIDS treatments. I'm Tom Smith, and for the 3rd year in a row, we're in the beautiful house of Dr. Michael Harbour to talk about what's new in HIV treatments. Dr. Michael Harbour is Associate Clinical Professor of Medicine at Stanford. And Michael, thank you for having us to your beautiful home.
Thanks, Tom. Welcome back.
So Michael, what's new in the world of HIV treatment?
Well, there's been a lot of advances in HIV treatment, and specifically advances that are really pertinent to patients who have been positive for quite some time, or those patients who've had problems with HIV resistance. They've been on therapies in the past that for whatever reasons have failed. Now we have new treatments to be able to sequence them too. So at this point in time, it's so exciting. It's like what we had in the very beginning of HIV medicine when many of these new treatments were becoming available. So I have a number of patients who have been on so many therapies, they aren't working. Unfortunately, their viral loads for HIV are continuing to rise, their T cells have declined, and despite all the best treatments at the time, we haven't been able to successfully, bring that viral load down.
How dramatically different are these new medications?
These treatments are very dramatically different. They are new classes of drugs that have come to market. So we've currently had 3 or 4 classes of drugs. Now we have 2 new classes of drugs with which to add to our existing classes of drugs. And that's all that it really takes. We need to treat patients with at least 2 to 3 new classes of drugs to bring that viral load down to undetectable levels. And when that happens, the T cells, which is our CD4 cells, a type of white blood cell, begins to then move up in response to that. And that's exactly what the body needs when you're HIV positive.
When will these new treatments become available?
Well, late this fall, a new class of drug called a CCR5 inhibitor. It's basically a molecule that blocks the entry of HIV into our T cell, our CD4 cell. And when that happens, the virus can't get into the T cell.
It can't get in, it can't replicate, it can't grow.
It can't make new copies of itself, destroy our T cell, and then move on. So that's one class of drug. There are a number of drugs that are in the pipeline that will be in that same class, but the first drug is a drug called Maraviroc, or the brand name is called Cellzentry. And this is the drug that people take twice per day with a very good side effect profile, and it's very effective.
So if you're on a stable medication like Atripla, should you change to these new medications?
That's a great question. People ask all the time, because of new drugs, do I need to necessarily switch to one of these new drugs? Does that mean...
And other side effects.
Yeah. Do new drugs necessarily are better to treat? People often think that because they're newer, they have to be better, and that's not always the case. In the case of Atripla, for example, Atripla is triple drug combination therapy, a drug called efavirenz and an existing drug called Truvada, combined together into 1 tablet daily. So it's 1 pill once per day. But they were drugs that have been out for a while before. So it's not necessarily new compounds, but the 2 competing companies got together, put their best drugs together, and now patients have 1 drug once per day. But then to follow up to your question about new drug therapies, the second class of drug that we have available to us now is an integrase inhibitor. And Merck has just come out with the first available integrase inhibitor. It's again twice per day.
And then how does that work?
It targets a completely different enzyme in the HIV replication cycle. It prevents that enzyme from making more copies of the HIV virus. It seems to be very well tolerated. It's extremely potent. It's working incredibly well. And that's another class of drug.
Sounds like you're really excited about these new treatments. Effective.
Very important. It's very impactful. I now have ways of treating patients that I didn't have 6 months ago. And then finally, we'll have a new class of drug in January. Well, excuse me, it's not really a new class of drug. It's an existing class of drug. But what's unique about this drug, it's similar to Sustiva and Viramune, classes of the drug of the non-nucleoside reverse transcriptase inhibitor. But this drug will sequence you should you become resistant to those drugs ahead of time. And that should hopefully come out in January, and that's made by Tibotec Therapeutics.
Is there anything new in prevention?
In terms of HIV prevention, really being aware that you can acquire HIV. It's not just a disease amongst the gay community. I mean, the most common demographic is now amongst the heterosexual community.
Really?
Yes, the numbers of amongst of gay men have pretty much stabled off and stabled and gone down, and hopefully will continue to go down. And patients that are heterosexual are the ones that are seeing this disease in their community.
Wow. Well, you know, we are out of time, believe it or not. But I know you're accepting new patients, and how would people get hold of you, if they, positive or negative, if they wanted to talk to you about HIV and prevention?
So I'm happy to
treatment?
see all new patients. I work at Stanford University in the Positive Care Clinic, and they can call 650-354-8101 to make an appointment.
Great. Well, thank you so much for having us in your beautiful home again.
Thank you, Tom.